Dr. Lisa Lawson, and as promised, we're going to discuss CBD today. So, first of all, what is CBD? What does it stand for? Well, it stands for the drug cannabidiol, which is a cannabinoid. Is it marijuana? No, it's not marijuana. Actually, marijuana and the hemp plant come from the same species, Cannabis sativa. The difference is their active ingredients. So what makes up the greatest component of the cannabinoids in that particular plant? So with marijuana, the most active ingredient is going to be the delta-9 tetrahydrocannabinol, which is THC, which has the psychoactive effects, the euphoric effects of marijuana. The second cannabinoid is cannabidiol, or CBD. So that you do find that in the marijuana plant. Now, the industrial hemp plant, on the other hand, its most active component is going to be the cannabidiol, or CBD. It still can contain delta-9 tetrahydrocannabinol, or THC, but it's limited in how much it can contain. So by law, it can contain up to 0.3% delta-9 tetrahydrocannabinol by dry weight. And so any plant that's grown in the United States, which is classified as industrial hemp, has to meet these criteria. So that's the difference between marijuana and the hemp plant. Now, as far as CBD goes, the cannabidiol, it is a cannabinoid. Now, in the marijuana plant, in the hemp plant, there are other cannabinoids, but those are the two that are the most familiar, the ones that you see most often, or that we're kind of discuss today. So, with CBD, what is CBD good for? Is it effective? Does it help? What is the dosage form? I mean, those are really good questions, and we'll kind of go over some of that today. Now, there is a difference when you're looking at, there is actually a commercially available CBD product. So it's a prescription product. It was actually approved in 2018 called Epidiolex. It is approved for the use to treat 2 refractory pediatric seizures, Lennox-Gastaut and Dravet syndrome. Now, because it is an FDA-approved product, the FDA says that CBD can't be sold as a dietary supplement. And so, but you're seeing it all over the place. And so the thing is the FDA will usually not do a whole lot. They don't regulate it. They don't really go in there and check on it because it's not a regulated product, unlike the commercial prescription product. But as long as you're not making claims that it causes, that it treats cancer, or that it, helps with, treats seizures, or that it treats pain, you're not making any classifications that it treats a particular condition, then most of the time they will leave it alone. But if you start making those claims or ads, then you can be expected to get a letter from the FDA. Now, the thing about CBD is it illegal or not? And that depends on what state you're in. It depends on, because each state has their own legislation. Now, in 2018, President Trump signed a farm bill which did take industrial hemp, explained exactly what it was, and it did remove the parts of the hemp plant that were grown in the United States from being an illegal substance, as long as the delta-9 tetrahydrocannabinol content did not exceed 0.3%, then that product would be considered industrial hemp, and it would no longer be a controlled substance. Now, this is different than what had previously been in there. Prior to 2018, the only part of the hemp plant that was not considered a controlled substance or illegal was the seeds. And so anything that came from any CBD product had to come from the seeds, and the DEA questioned whether or not there was enough CBD in the seeds to actually make a product. So that's always been, so now from a federal standpoint, from the DEA standpoint, CBD made from industrial hemp plants, the stalks, the root, the leaves, is no longer illegal. However, the FDA is still questioning whether or not it can be used as a supplement because there is a prescription product. So for the consumer, it doesn't really make that big of a difference. So from a legality standpoint, if you go in to purchase a particular product, you're fine. From a business standpoint, that may, it's still kind of an area to be explored to determine exactly where you're going to fall on the in the federal level. At least from this standpoint, it's no longer illegal. So from the DEA standpoint, which is a good thing. Now, so the thing is, you're going to see CBD advertised everywhere. And then you see something called full spectrum. So what is the difference between CBD products and full spectrum? Well, so CBD products will be CBD only. So we've carried both. We've had just CBD only products, and then we've had the full spectrum. The full spectrum means that they're allowing that 0.3% of the tetrahydrocannabinol to be in the product. Now, CBD itself does not cause that euphoric psychoactive effects. While it does act on receptors in the brain, it does not act to the extent that THC does. So you're not going to necessarily see this high that you would have from the THC when you're using a CBD product. Now, if you use a CBD product that contains THC, even at the 0.3% level, you can have a little bit more psychoactive effects. And depending upon how much you're taking of the product, that 0.3% can start to add up in the long run, especially if you're using it every day. So a caution we'd need to be cautious about using a CBD product with THC, especially if you're involved because of your job. In a year, so when you have a marijuana or when they test for THC in the urine drug test. They're not testing for CBD, they're testing for THC. But if you use a full spectrum product that contains a small amount of THC, then you could test positive in a drug test. The other thing is that even if you use a CBD only product, there was a study that was done a couple of years ago for looking at some of the CBD oil products in the market. And what they found that only 32% contained the amount of CBD that was stated on the label. Of the other 68%, what they found that there was about 40-something% that had more CBD in it, 29% that had less CBD oil than stated, and then about 40% of the products that did not state that they had THC actually had THC in them. So you may think that you're getting a CBD only product, but it actually contains THC, and then you go and take a drug test and you fail it. And so, which is a very real possibility. Now, because of that, as a pharmacist and as a business owner, I would recommend that you only use products that have that are tested, that they can actually verify. They can give you a certificate of analysis that says exactly what that product has in it, the exact CBD content, if it contains THC, how much is in that product. And so it should be somewhere on the box or label that you get. There may be a QRC code that you can scan and it downloads that information. Maybe there's a website that you can go to and then you can get the certificate of analysis for that particular lot number that you got. You should never buy a product that you are not able to do that, because you have no way of verifying what's in that product. And there are going to be products out there that are not going to meet the standards because the regulation is not there. So what you use is very important. Now, so you've picked a product and it's a good product. Now, how do you use that particular product? Well, so the thing about CBD is the dosage range is way out there. So it starts anywhere from 10 milligrams a day to 1,500 milligrams a day. I mean, that's a wide range. So where do you go for the particular condition that you're wanting to treat? Well, as a pharmacist, I typically tell patients, you know what, start low and then build up from there. Because the thing is that, people, everything that gets, when it's considered over the counter, people think that everything over the counter has no side effects. It's safe for everybody, you can't, it's natural, you don't have to worry about it. And that's not true. I mean, most of our drugs were derived from natural substances initially, and they can be toxic. So just because it's over the counter, just because it's not behind the counter with a prescription, doesn't mean that it's completely safe for everyone to take. So you do need to know exactly kind of what you're trying to treat, what dosage that you should be looking for, and it will also what medications that it might interact with, because there are medications that the CBD does interact with. So first of all, as far as dosage goes, so obviously, since you have this approved product that they use for seizures, that CBD can obviously be used for seizures. It's been beneficial. Typically the dosage on that is going to be in the higher realm. They usually start the dosage and it's for children, on a milligram per kilogram basis. And that starts at the very beginning at 2.5 milligrams per kilogram twice a day, going on up to 10 to 20 milligrams per kilogram per day. Just to put that in perspective, so if you were dealing with an adult, then a 150-pound adult at a 10 milligram per kilogram dosage is going to get somewhere around 600 and something milligrams a day, which is huge. And so you have products in the market right now that only contain 600 milligrams per the whole bottle. And so that's a daily dosage. So obviously those dosages for seizures are going to require a lot more, and it might get cost prohibitive. So if you're going to be using it for seizures, then you're probably better off using the prescription product because it's more concentrated. It's 100 milligrams per milliliter concentration. And so while it's only approved for the treatment of 2 seizures now, doctors can prescribe it off label. They do not have to use it just for what it's approved for. And so as the research starts occurring now that there's a prescription product, then hopefully we'll start to see more indications and better dosage regimens for particular treatments. Now, so most people are interested in CBD because of pain. The opioid epidemic has caused the state legislators to come in and start reducing the dosages of opioids, and so people are hurting, or they're scared, or doctors are not writing for things, or maybe they're just wanting to come off because of safety issues for whatever reason. So a lot of people are looking to CBD and asking, can it be beneficial for pain? And the answer is yes. Can the CBD with THC be beneficial for pain? The answer is yes. The combination, the CBD with the THC, is actually a little bit more beneficial for pain relief, but you can have more of the psychoactive symptoms. So you do have to be careful because it can affect your driving, or it could affect your ability to operate machinery. So you do want to be careful with how you would be using the CBD. Now, so as far as for inflammation, so say someone's got arthritis, which product would be better? So the CBD itself is actually a good anti-inflammatory agent. The reason that it works for inflammation, it seems to block the release of cytokines. So it's a cytokine inhibitor. And if you're familiar with, there are some prescription products that are actually used today for autoimmune disorders such as Crohn's or rheumatoid arthritis, and they work by inhibiting the cytokines. And so it's at the top of the line on this inflammatory cascade. So it does work for inflammation. So for arthritis, both osteoarthritis and rheumatoid arthritis, it can be beneficial. Probably at different dosages. You would probably need to you could probably get by with a lower dosage for the treatment of osteoarthritis, whereas you would probably need a higher dose for the treatment of rheumatoid arthritis. Now, that being said, the thing is that you have to realize that if you start inhibiting cytokines, which are involved in the immune system, it can increase your risk of infection. Just like the prescription products, where there is a risk of infection that is associated with each of those, then if you're using dosages of CBD to treat an inflammatory, like rheumatoid arthritis or multiple sclerosis or some type of autoimmune disorder, then it does put you at risk for infection. About 25% of people can develop or can have an increased risk of infection. So you do need to be careful if you're going to be on CBD, especially at the higher dosages. As far as pain relief, a lot of times you start lower and you go up. So it's, you will notice if it's going to help pretty quickly. So as far, the exact mechanism by which it helps with pain. So we know kind of how it works for inflammation, but for just pain management, they seem to think that it will block these certain calcium receptors in the brain that will regulate the process of pain, like relaying pain. And so it kind of blocks that, kind of similar to opioids, but it doesn't work on the same receptors as opioids, and so it doesn't have the same side effect. Now, as far as if you start CBD and you try it, are there withdrawal effects? Well, with the CBD, you don't see that. You can kind of start and stop it. If you use the CBD with THC, then yes, THC does have a potential for addiction. And so even though it's a 0.3%, over time, especially if you're using higher dosages, then that can add up. Or if you use it for a longer period of time, then that can start to build up because it is a fat-soluble substance. And so that can leach into fat cells and then be released over time. So you do have to be careful with the products that contain THC versus just the CBD only products. And again, to make sure that you're only getting a CBD only product, because just because it states it on the label doesn't mean that it just is only CBD, then you need to make sure that you're getting only reputable brands that either have like hemp certified, they have lab standards on them, or they will provide you with a certificate of analysis showing exactly what is in that product. So that's very important. So you've decided to try CBD. You're going to try it for a particular condition. What conditions does it help with? There have been some studies that show that yes, it can be beneficial for sleep at certain dosages. It tends to, the lower dosages on the CBD tend to have more of a stimulant effect, whereas the higher dosages tend to cause more somnolence or sedation or drowsiness. So even though CBD doesn't have the psychoactive effects that THC does, that doesn't mean that it doesn't cause drowsiness, especially at the higher dosages. It still can cause drowsiness. It still can affect muscle movement, muscle spasticity. That's one of the reasons why it helps with seizures. It can make you feel tired or draggy. So it's not just this just this anybody can take it type of drug. So you do need to be careful, and you need to be aware that it can have side effects. Not only can it have side effects, but it can also interfere with other medications. Certain medications can change the dosage that you need of CBD. CBD can also change the dosage that you need of another medication. It's cleared through the liver through the cytochrome P450 system, specifically the 2C19 and 2D6. And so when you take drugs that that inhibit those particular enzymes, then you may need to reduce your dosage of CBD. If you take drugs that will act based on those enzymes and increase them, then you may have to increase your dose of CBD depending. There are also, if you take the CBD only versus the CBD and THC, that can also affect, can have more drug interactions, the ones with THC, because THC is highly protein bound. So certain drugs that are highly protein bound may cause an issue when you're taking CBD, and you may have to adjust it. One of them is blood thinners. Warfarin can be affected by CBD. So if you're a heart patient and you're on warfarin, then you'd have to be really careful about what dosage you're taking, and any time that you make a dosage adjustment, add or take away, if you have the THC or you don't have the THC, that can affect your levels. So that would be something that you'd have to be really careful about. There are certain seizure medications that you have to be very careful with, because they can either decrease or increase the effectiveness of the CBD, or CBD can increase or decrease the effectiveness of that medication. So if you're going to try CBD, I encourage you to talk to your pharmacist wherever you're getting your prescription filled, to make sure, or your doctor, to make sure that your medicine is not going to interfere with the CBD, or that the CBD is going to interfere with your medication. Now, just because there is an interaction doesn't mean that you can't use it, but you just need to make adjustments, and you just need to be aware of any time that you make adjustments, how that might affect your other medications. And maybe that you shouldn't take it at the same time. One of the things with the CBD, because it is an oil-soluble drug, is that if you take it with a high-fat or high-fatty meal, then that may increase the absorption. If you are a person that has heavier versus thinner, then your dose of CBD is going to be different, because you have a different physical makeup. And so where it deposits, like how much stays in your bloodstream, is going to be different. And so your dosage is not going to be the same as your neighbor's dosage or your brother's dosage or whoever's dosage, because your physical makeup is slightly different. And that's why it is a little difficult right now to determine exactly what the proper dosage is for any particular condition. And so a lot of times, again, starting low and working up. I mean, you have a high ceiling in which that you can get up to. Once you start getting up to those higher dosages, though, the cost can be extremely expensive, because this is not a cheap drug, or this is not a cheap supplement. And so when you start getting up to those higher dosages, it's not covered by the insurance. There may be a prescription product that would work just as well and not have as much of a cost associated with it. But if you're able to use it at lower dosages, it could be beneficial. Now, for patients, for example, with autoimmune disorders, I feel like CBD can be very beneficial, because the agents that they use that are commercial prescription products are very expensive, and they have a lot of side effects. Probably can affect your can increase the infection rate a little bit more so than the CBD products. And so that might be an option, a safer alternative, because the side effect profile is a little bit better with the CBD versus the prescription products. But again, that's something to talk to your doctor about or talk to the pharmacist about. So, what are the side effects of CBD? Well, as I mentioned, it can cause drowsiness or sedation, so especially at the higher dosages. It can be used to help with sleep, but in the lower doses, it can actually cause people to have trouble sleeping. It can disrupt their sleep in some way. So trying to find that balance of so if you were to take a CBD supplement and, for example, 10 milligrams, and all of a sudden it didn't put you to sleep, or it actually caused the opposite effect, then what you would want to do is would want to raise the dosage, because there's a certain amount that causes one way, and then a higher amount that causes an opposite reaction. So sometimes, again, playing with the dosage, understanding what the right dosage is for you. Now, if you're taking CBD for nausea, it's not going to work very well. You'd have to have the full spectrum, the CBD with the THC, because the THC component is the one that's been associated with nausea control. So if someone was taking CBD for migraine, which has an inflammatory component, but then also too, they have this prodrome where they're nauseous, then a full spectrum product with CBD and THC would be better for them, because they would need this, something to help with the nausea associated with that prodrome, versus just the CBD, which would be the pain and inflammation. So the other things that can be seen is that sometimes it can cause some stomach upset. It can cause diarrhea in some individuals, and it can also it can cause your liver enzymes to be increased. Again, because it's cleared through the liver, then so sometimes, so they do recommend, with the prescription product, that you are having your liver function test done. If you're taking the over-the-counter supplement, you may, at the dosages they're taking, it may not affect you, but it's probably something that if you're being followed by a doctor, they probably need to make sure that they're aware that you're taking the medicine, and if your liver enzymes increase on a test, then it could be related to the CBD, and you would need to stop it or reduce the dosage. So that's just a little bit about CBD. I'm sure there's more questions that can be answered. I just wanted to kind of go over what CBD was. Was it legal? Some of the how to take it, what to be concerned about. So just as an ending point, I just want to kind of clarify that it's really important that you know where it comes from, and that you're getting it from a source, because there's multiple places. There's the gas stations that are selling it, there's the tents on the side of the highway, there's pharmacies that are selling it, there's dispensaries. So there's multiple places. It doesn't matter so much where you get it from than what type of product you're getting. You really need to make sure that there is a certificate of analysis, that they have that available, so that you know that you're getting what it says on there. The other thing is understanding is that the way they label the CBD products is very confusing. So a lot of times, if you'll have a bottle of CBD oil and it'll say 600 milligrams. Well, that 600 milligrams is not the dose of CBD. It means that contained in that bottle is 600 milligrams of CBD. So if you do a dropper full of this particular product, then it may have a different concentration than this product. They both may contain 600 milligrams, but the concentration is different between the two. So you need to know what your milligram dose is, not just how much you take. Oh, I take a dropper full of this. Oh, I take 5 milliliters of this one. I'll take 5 milliliters of that one. It's not the same thing. So you need to know how many milligrams, and so depending upon what product you're using, then you make sure that you're doing milligrams for milligrams on there. If you're using a CBD only product versus the full spectrum, which is the CBD plus THC, that's important, because they do have slightly different effects, and the dosages are going to be different. So you probably don't want to be switching back and forth between the two. Use one or the other. The other thing is making sure that your medications, check with your pharmacist, check with your doctor to make sure that your medications are not going to be a problem with the CBD or the CBD and THC, because there can be drug interactions. It could affect your ability, maybe your medications may not work correctly, or maybe they need to be reduced, because you would hate for all of a sudden for you to get toxic on a particular substance because you added CBD. Because in the long run, you're trying to help your health and not hurt it. So that's important to make sure that it's not going to interfere with one of your other medications. The thing is, again, consistently, if you're going to start with a product, I do not recommend jumping around. It's just, different manufacturers have different standards. So if you're wanting to use a product, then you probably want to get one and stick with it and continue to use that, and just, vary your dosage using a particular product or company, rather than go here, wherever's having a special and that type of thing, because there can be differences between manufacturers. And then, lastly, just understand that, CBD is not a miracle drug. It's not the cure-all for everything. There are cheaper alternatives, prescription-wise, that might help with your condition. There are medications that you're probably already taking that might be better in the long run. But can it be beneficial? Yes. And so is it worth trying in some individuals? Probably so. But just understanding that it is not a cure-all. It doesn't mean it's not without side effects, because it does have side effects, and sometimes those can be bothersome to some individuals. So if you have questions about the product, or if you want to talk about it some more, you can give us a call. You can ask a question on our website, the Facebook or YouTube channel, and we'll try to get back with you about that. But just, be safe, and just, and be informed. That's important. Thanks for tuning in.